Hi, I'm Dr. Mike Milligan. I'm here with Dr. Kent Smith in Irving, Texas by Dallas. I'm here for his sleep apnea course the next couple days, but here we're visiting with Kent, and he's going to tell us all about it right now. Kent, thanks so much for being with us.
My pleasure. Thank you for coming out.
Great. Well, so you've been doing this, the sleep apnea. You were one of the early adopters for sleep apnea and how dentists can help with that. Can you give us a little history and then tell us where you're at now? And
sure,
how
be glad
involved
to.
With it and all.
Yeah. I didn't really have a come to Jesus moment with it, or I had a father that died of sleep apnea, anything like that. But I did have a sincere interest in sleep since I was even in junior high. The nighttime fascinated me.
Okay.
Then I went to dental school and I realized, okay, well, I'm just going to do teeth now.
Yeah.
Then I realized later, you know what? I really can affect how people sleep. There is a tie-in here. And because it fascinated me so much, I just read as much as I could.
Wow. Okay.
I mean, I have been an avid reader in anything to do with sleep for so many years that I can tell you anything about sleep you want to know.
That's interesting. Okay.
And so that's with the courses, that's one thing we do. We talk a lot about the basics of sleep first. And that really interests a lot of people. You know, some people have narcolepsy, or they have restless leg syndrome, or they have some other things going on that we really can't help much. But they've got friends and family and people they work with, et cetera, with some of these sleep problems. And once you start talking to your patients about sleep disordered breathing, they're going to tell you about their other problems in sleep.
Sure.
So it helps to know that.
Yeah. And you know, sorry for interrupting, but you know, I used to think you could work right through or play through and not need that much sleep, and you could just will it away. But come to find out several years ago, you need that for your health. You really need 7-8 hours of sleep a night.
Yeah, you do.
For your health. You're going to increase your risk of heart disease and all other kinds of diseases if you don't get it. You need your sleep.
Right.
And so it's become very important.
It is, and we affect the quality of sleep. When you say 7 or 8 hours of sleep, that's true. Some people, though, they can go to sleep at 11, wake up at 7, and think they got 8 hours of sleep.
Yeah.
But if it's not effective sleep, we look at the efficiency of sleep, and if it's not efficient sleep, they could really just have 5 hours.
Right.
And when you're talking about the increased risk of cardiovascular disease, et cetera, it increases tremendously when you get less and less hours of sleep.
Yeah.
There are so many studies out there showing the link to amount of sleep, even to oral health.
Really?
Oral health.
I didn't know that.
Smoking is the #1 thing that affects oral health. #2, sleep.
You're kidding.
Nope.
Well, I'm going to learn about all this the next couple
Yeah,
of
the
days.
American Academy of Periodontology has made that bold statement.
Wow. Okay.
Years ago. Through their research, they have, and you know them, that's a group that doesn't just say stuff.
Yeah, right.
They like research.
Right. Okay, so you got involved with this, you said about in dentistry about 4 or 5 years ago?
Well, in teaching the courses.
Okay.
I've been treating these patients for many years. We were, in fact, my office manager, Kelly, has been wearing an appliance for 10 or 12 years.
10 or 12 years.
Yeah. So, yeah, we've been making them for years, but then I realized that, you know, we needed to tell other people about this. The physicians don't look for it. 90% of these patients are undiagnosed.
Wow.
So I really think in dentistry we are the front line.
Yeah.
We are the people that should be diagnosing, or at least screening for. We can't officially diagnose sleep apnea, but we need to be looking for it and screening for it. So it's something I think that needs to be out there, and every dentist should be doing it. So I'm trying to make that happen.
Get the word out. Okay.
Yeah.
All right, so you need this sleep, and even if you think you get it, oftentimes you're not. The sleep study will show you that.
Exactly.
And we're able now, there's been new laws that we're able to do that, and new technology, I guess, so that we can do that through home. They don't really need to go to a sleep study
Exactly.
to get a pretty accurate reading.
Yeah, in April of '09, I think. I keep getting that. Anyway, about a year and a half ago, something like that. They decided, CMS, it's the Medicare group, the Medicare said, okay, you can use these home ambulatory units to diagnose sleep apnea. Before, that couldn't happen.
Right.
Well, when that started happening, then all of the indemnity companies came on board, and so really they can be used to diagnose now. They don't have to go off to a sleep study at a sleep center anymore.
Yeah.
We still work with sleep centers. It's important to develop that relationship with the sleep physicians in your area. And they really don't have the belief in the ambulatory monitoring yet that we do. they still are very proud of their sleep center studies, and I understand that. But your sleep is much more like your actual night of sleep in your own bed than it is at a sleep center.
That makes sense, yeah.
So even though there's not as many leads from this home unit, I think, and really they removed the PSG, the Sleep Studies Center, from the gold standard list. It's no longer the gold standard.
What is the gold standard?
Well, there's not a gold standard now.
Okay.
The home units are just as effective.
So they're valid. It's a valid study.
It's valid.
Okay, and the research has shown, and the bigger organizations are now saying that it's a valid system for diagnosis.
A physician still needs to diagnose from the ambulatory study.
Right.
Yeah.
Okay, super. But then a certain percentage of these patients, the dentist is able to, and we're able to tell somewhat from the study, the ones that will be effectively treated with a dental appliance.
Sure. And there's a lot that goes into this. I don't really have time to get into all of the details of who would benefit from an appliance and who wouldn't. No. But the American Academy of Sleep Medicine, that's the physicians group, has said that oral appliances are a perfect option with mild to moderate sleep apnea.
Okay.
So they made that statement 4 years ago. It's just that all of their members haven't really studied their own protocol yet.
Sure.
They don't know that. So you might not get physicians to understand and agree with you, but in dentistry, we have a part to play. We're part of the sleep team now, and we should be treating at least the mild and moderates. I treat many severe apneics too, because there's so many that are non-compliant.
Yeah.
If they can't wear a CPAP, then we're the next ones in line.
And so many people either can't or hate to wear that thing.
Exactly.
You know, and so we're the next in line.
Yep.
What else? What else would you like? Where do we learn more about this, Kent?
Well, if you go to DallasSleep.com, that's my own sleep website, and that's really for patients.
Yeah.
But there's a section on there for dentists, and they can click on that and find out more about courses.
Come to your course.
But I think it's important if you get into this to market yourself that you do it and get the word out.
You bet.
And so that's what that sleep website is all about.
Okay. All right. And you show us how to both do the sleep study and the reading of that and the appliance, as well as marketing it and the whole 9 yards.
Yeah, you have to find out which of your patients, and we screen every one of our patients. So you need to screen them all.
Okay.
Because we have, you get your typical apneic that's really big and big neck, and you can tell they're going to be the snoring apneic. But we've got thin females with sleep apnea.
Okay.
So we teach how to screen, how to get them diagnosed, the different options of treatment, including the way we treat them.
Okay.
And then how to get your patient to see their problem, and then how to get paid for their problem.
Fantastic. That's everything then.
Yeah.
Is there anything that we've missed on? Because I haven't taken the course yet. Is there anything else you'd like to tell us about sleep apnea, the dental treatment of that, and the validity of dental treatment of that, or your course?
Sure.
Is there anything else you'd like to tell us?
I would like to specifically mention that snoring is not just a funny thing.
Okay.
And many dentists have been treating snoring for years, thinking that they're just treating the snoring, they're not getting somebody studied or tested before they treat them. They'll just make them a silent night appliance or something like that without knowing. I use the metaphor of giving somebody a blood pressure medication without first taking their blood pressure. What physician would do that?
None.
Nobody.
Right.
You can't treat somebody without finding out exactly what the problem is.
Sure.
If they snore, what they could be doing is create silent apnea. You have somebody that stops snoring, but they still have sleep apnea.
Okay.
If you're not following them up with testing, you've put a Band-Aid on a problem that may be a very serious issue. You talked about cardiovascular issues.
Yeah.
And there's dentists out there all over the place that are doing this without testing, and it's a slippery slope.
Okay. All right. Well, Kent, thank you so much. Appreciate it.
My pleasure. Thank you for coming out.
Great.